When a new physical symptom appears, a sudden chest pain or a strange rash, the immediate crisis is rarely medical. It is a sharp, blinding spike of human fear. Many turn to algorithm-driven symptom checkers for answers, but these systems strip away the psychological context of the individual. They offer a wall of terrifying possibilities without considering the person behind the symptoms, leaving the user passive and increasingly anxious. For millions of people, the elderly, the illiterate, and those without reliable internet, the problem is even more basic. They exist in a complete vacuum of guidance, cut off from the digital tools most of the world takes for granted. Language barriers further isolate immigrant communities and rural populations. These groups are often left to navigate standard healthcare systems that are built exclusively for English-speaking, formally educated patients. When uncertainty meets a physical symptom, fear dictates the next move. In this vacuum of information, patients are forced to make choices that often harm their own recovery and strain the medical systems trying to help them. This unmanaged panic has massive systemic consequences. Hospital waiting rooms become physically bottlenecked as individuals rush to the emergency department for minor viral colds or mild fevers that could be managed at home. Local pharmacies face a similar flood, with patients demanding immediate medication for perceived emergencies that do not require clinical intervention. This pressure forces pharmacists into risky overprescription. That unnecessary use of medication accelerates the rise of antimicrobial resistance, creating a new generation of superbugs that our existing treatments cannot kill. This isn't a theoretical threat. Drug-resistant infections are already responsible for over 1 million direct deaths every single year. The modern medical system is reaching a breaking point because it lacks an intelligent valve to filter human panic from genuine medical necessity. The Prema Kiosk addresses this gap as a standalone, touch-free hardware terminal. It is built to function entirely off the grid, powered by solar panels and operating independently of cellular networks or power grids. It bypasses technical and literacy barriers by using voice guidance in over 30 languages. This allows anyone, regardless of their education level or native tongue, to access clinical-grade guidance. The engine behind the screen is Dr Maya GPT. It processes symptom patterns using 50 years of clinical experience, allowing the AI to understand the context of a patient's story, rather than following a rigid, isolated decision tree. This turns the kiosk into a universal translator, taking high-level clinical intelligence and converting it into a simple, human-centric dialogue for the person standing in front of it. The system distills data into a 4-color code. Green indicates minor illness, suggesting self-care or a nurse triage call. Yellow means watch symptoms or consult a chemist. Blue flags infection risk, prioritizing isolation and medical consultation. Red signals a life-threatening emergency. Call an ambulance immediately. In the vacuum of a medical crisis, a single color provides the one thing panic cannot produce, a concrete path forward. It replaces the paralysis of uncertainty with a clear, immediate instruction. These kiosks are not managed by distant tech corporations. They are operated by local community members, often women's self-help groups within marginalized communities. This model creates a microeconomic engine. Operators earn a self-sustaining income through consultation fees, document printing services, and local advertising displayed onto kiosk screens. For the local pharmacist, the kiosk removes the pressure of guessing a diagnosis under duress. Supported by the AI's pattern analysis, the pharmacist can step back into the role of a trusted guide for their community. Prema acts as a dual-purpose catalyst. It deploys vital health infrastructure while simultaneously building a localized economy that sustains it. The macro-level impact is significant. By filtering out non-emergencies at the community level, the system can redirect up to 40% of avoidable GP and emergency room visits. This systemic filtration allows hospitals to focus on critical cases, enables earlier outbreak detection, and enforces the antibiotic stewardship needed to protect future generations. Scaling healthcare for billions is a challenge of distributed intelligence. By placing clinical guidance into the hands of the community, local residents gain the agency to manage their health and survive the post-antibiotic era.